Thank you, Dr. Rotman, for being here today. You'll have 5 minutes for your opening testimony.
Thank you, Chairman Schuler, Mr. Lichtenmeyer, Representative Klein. Thank you very much for that introduction, and members of the subcommittee. As Representative Klein mentioned, I'm a practicing orthopedic surgeon in Fort Lauderdale. I represent the American Association of Orthopedic Surgeons, which represents 17,000 board-certified surgeons across the country. I appreciate the opportunity to present our concerns today with the many changes being implemented by law and regulation concerning DMEPOS. We share Congress's aims of increasing the quality of patient care, eliminating fraud and abuse in the federal health care programs, and reducing the cost of delivering care to our beneficiaries, our patients. It is our pleasure to be here today and continue to work towards these goals. With that said, I would like to highlight what we believe to be unintended consequences of applying rules meant for retail DMEPOS suppliers to physicians in small practices across the country who provide certain DMEPOS as part of providing our high-quality care to our patients. This includes orthopedic surgeons who treat fractures and apply braces and splints to patients' arms and legs, and take care of patients with ambulatory problems requiring crutches and canes and walkers. It is important to note that we're talking about doctors who supply these materials to our own patients, not to the public, because we provide these materials as small businesses, and sometimes in rural areas we are the only suppliers of these materials that we stock in our offices for the care of our patients. Our concerns that we have regarding some of these new and revised rules pertain not specifically to the competitive bidding process, which I know we're here to talk about today, but I'd like to address primarily the accreditation issues as it applies to doctors, because we've been lumped in with these businesses requiring this accreditation process. CMS has signaled even today that it might implement what we feel are unnecessary requirements that physicians be accredited like these other businesses to provide DMEPOS to our patients. This threatens to interfere with our continuity of care and our patient relationship. I would tell you that the rules were changed in May of 2008, and I'd like to thank Committee Chair Velasquez and Chair Schuler for helping to change those rules. That released the doctors from the competitive bidding process and the accreditation requirements temporarily, but we're looking for a more permanent fix because we're getting signals from CMS that accreditation is down the road for physicians. We believe that the Secretary of HHS should exercise the authority granted in MIPA to permanently exempt physicians and licensed healthcare professionals from the quality standards and accreditation requirements, considering the licensing and training and accreditation requirements that we already go through in our states and in our societies to practice our craft. We acknowledge and share your interest in ensuring Medicare beneficiaries receive high care supplies and quality service. We are equally committed to ensuring that patients have access to the care and supplies they need in a safe, efficient, and timely manner. We believe that as orthopedic surgeons, this can best be provided by us at the point of service. When I treat a patient with an ankle fracture and they're in my office, I need to make sure that fracture is stable. I can put them in a cast or a brace, but to enable them to get home and become ambulatory, I need to be able to give them crutches or walkers or canes at that point of service. I can't discharge those patients from my office with an unstable fracture, write a prescription and say, go get this somewhere in the community. I stock these materials in my office. I submit my invoice to Medicare for my reimbursement, and I'm paid a small pittance, perhaps 10% over my invoice cost. I simply want to provide this to my patients as a service, not for profit. In order to go through the accreditation process, this would cost doctors $3,000 every 2 years. My total billing for durable medical equipment in the last year was less than that. So to submit me to a $3,000 accreditation process would totally take this out of my office and not allow me to provide this service to my patient. In addition, I'd like to tell you my personal experience. CMS has withdrawn my supplier number. They have made me jump through hurdles over the last year. I've been providing these materials to my patients over the past year at my own personal cost because of bureaucratic hurdles. The fact that the accreditation process was originally required and then changed, and I believe that doctors like me are subject to a very large net thrown over the South Florida area in particular, looking for fraud and abuse, and we have been caught in that net and been subjected to unfair and inappropriate scrutiny when what we're doing really is providing what we feel quality and medically appropriate care to our patients. I would like to thank you, Chairman Schuler and Mr. Luetkemeyer, for allowing me to be here today and tell my story. Please allow me and my colleagues to continue to provide high-quality health service to our patients and facilitate their recovery and their ability to heal from their musculoskeletal injuries.